What's up, guys? I am here. Come on in with me. Maybe not.
They're joining.
Huh?
Joining.
Yeah, we need to start. Okay, so excuse for all the technical difficulties. There are going to be a lot of those tonight, I'm sure. So I want you guys to head in with me to Ageless MD, as promised, where I was taking you this evening. And what we're going to talk about is non-surgical male enhancement. And we're really going to get into 3 topics specifically. It's going to be about size, of course, girth specifically, and sensitization. So getting you more sensitive if that's something you need, and also desensitization in case you're already too sensitive, maybe premature ejaculation is a problem, this type of thing. So come on with me. This is the office, by the way. You're told this is my doctor, and he takes care of my skin and all kinds of injections I do here. I trust this staff with my face and my other body parts as well that I want beautified and enhanced. So keep on coming. I'm gonna bring you in to see the man himself. By the way, fantastic selfie walls. This is Dr. Sai.
Hey guys.
And don't be afraid, we do have a chicken neck here for the demo later, which will be a lot of fun.
Oh yeah, not a real one.
Let me start this live here. We got all the platforms going. Let's see if that'll kick in for us. Do not get such a close-up on that. Frightening people off the bat. Okay, so let's see. Why am I not getting a signal here? Let's see if this side's working for us. We might have to have Chris take a look. It's not going on. Okay. Yeah, so here we are. We are gonna do this dang thing. I'm excited to have this conversation. I feel like it's something my followers have been very interested in. I get a ton of comments and questions about size mattering. And you are, interestingly, maybe off the top we can talk about fallow boards, because you obviously are like kind of sitting on that board and seeing so many guys with this interest that it's like a really serious conversation.
Yeah, so regarding that, the fallow boards with a PHALLO boards.info, it's a website. It's basically a forum. There's forums for just about anything out there. There's forums for cars or working out or jewelry. I mean, whatever you're into, there's a forum for. So this particular forum is the only one of its kind where guys can go on anonymously, talk about their size, talk about their phallus, talk about what things that they've done to it, piercings, tattoos, medical procedures, or you name it, there's something out there. And they can go on anonymously and share their experience. And people are really into their phallus on this website. I mean, they are really into it. So if you're into that kind of thing and want to learn more, or at least what other people are doing.
Yeah, I just love that there's a place you can like take some of the taboo away from this, because I was thinking about this, and I'm letting people kind of get on to the live before we get into the nitty gritty of how the actual enhancement procedures work, because I know that's going to be a big interest to a lot of people on here. But I was thinking the other day about how women, we've been doing plastic surgery for a very long time, especially like myself. I've had several breast augmentation surgeries, doing filler and all kinds of things in the face. And I don't think about it as taboo because our culture just sees it as normal these days. I think in the Pam Anderson days, it was a little bit more taboo having a breast aug and talking about it and that type of thing. But nowadays it really isn't. But when it comes to penis enlargement, male enhancement, it's like, hold on, like somehow that's different, but I don't understand why.
Well, I think now there's not a lot of information, and a lot of people don't know it even exists.
Yes, I didn't know that this particular way existed.
Right.
Yeah.
Right. So for many years, and it's now becoming more and more available, but it's still very early. People are still finding out about it. Every time I post about it, like that's a thing. I'm like,
Yeah.
That's a thing. And women can't have all the fun too. I mean, guys want enhancement, and they should allow to be fulfilled to have the enhancement.
Yeah, I agree, and a lot of the work I do on my platforms is about confidence, and that's why these questions come to me often about penis size, because that's that's an area that a lot of men don't feel confident in, or are worried in some way that they are going to be judged negatively, or have had some experience where their performance was off, or someone said something about their size, or hit him with a low blow, or whatever it was. And it just, for me, it's, of course, I'm going to go to the psychological or spiritual side of it because that's the work I do. But I also, like I said, I had a breast augmentation, so I know how tackling it on a physical end can be very helpful to getting you in the momentum of boosting your own confidence and relearning, the type of body you want to have and that type of thing. Of course, that's to go alongside with thinking through whatever the root issues are of that confidence issue. But I love that there is opportunity now for a non-surgical option for men to have male enhancement. So beautiful stuff. It looks like we are on all these platforms, so I believe that's working. We're just going to hope it is on that guy. But so let's kick this thing off and really get into the 3 types of enhancement that are available here. Non-surgical, we'll call it minimally invasive at the most. I don't know if you technically have to say it one way or the other. But what are the 3 different types of enhancement that we're looking at today?
Well, I specialize because I'm a physician, so I specialize in medical grade. There's things that you can buy at the sex store. There's paraphernalia. There's straps. There's different things you can buy, pills, things you can take. But what I specialize is in the medical grade. So things that is a procedure. So there's different procedures. So one of the things involves, it's called PRP. So PRP is taking your own blood and spinning it and re-injecting it back, and basically we're concentrating your growth factors so that it improves the blood flow, and that gives it increased size and increasing the sensitivity.
So where do you re-inject PRP?
So it is injected in the shaft. There's a 5-point injection, so we inject it into the shaft and into the glands.
Okay.
So, but they're numb, so the pain is very minimal.
The glands being the head.
The glands is the head. Correct. And so that is PRP, and it's mainly for people that have some sort of erectile dysfunction, which is common. I mean, most guys that are over 40, raise your hands. I mean, a lot of my friends over 40, they're already feeling some effects of it. It's very, very common in the 40s. And of course, when you go older in the 50s, it's even more prevalent. So basically, it's going to replace your Cialis and Viagra and all the other supplements that you feel like you need to take. But it gives a little bit of size enhancement as well. Mm-hmm. The other would be surgical. So I don't do surgeries, but that would be more like putting in an implant. Yeah. Surgically replaced. That's a little bit more aggressive.
Right.
It's definitely more invasive.
And definitely invasive. Right.
And permanent. And there's also a lengthening procedure called suspensory ligament. There's actually a ligament that pulls the penis in the pelvis. And if they snip it and they cut that ligament, it actually extends it by like a little, 1/2 inch to 1 inch. Wow. Not significant, but it is an option to lengthen.
Yeah.
But studies have shown that men or women actually get more pleasure from girth.
Huh. Yeah.
So this is very well known. This data is very well known. So what I specialize is in girth enhancement. So I use different substances such as fillers, the same ones used for your face, for your cheeks, for your lips, and then I insert it into the shaft to make it thicker and girthier. And then I also can insert some hyaluronic acid, same fillers, into the glands to make that a little bit bigger.
Okay.
And then a little side note, there's some guys that have issues with what's called premature ejaculation. Sure. And I inject the fillers in the glands and the head, and it actually decreases the sensitivity and helps with their premature issue.
And so what about, the first thing that comes to my mind is if you're doing this filler procedure to make the penis girthier, and then it becomes desensitized, but that isn't the goal, is there a way to resensitize with the PRP?
Okay, so let's clarify. So the procedures that I do, the growth enhancement, doesn't affect the sensitivity.
Okay.
So they don't affect sensitivity. In fact, there's been improvement in sensitivity, especially with the PRP, but with the growth enhancement, it doesn't affect sensitivity at all.
Okay.
Yeah.
Wow.
And in fact, when I do augment the shaft, sometimes I have to augment the head. Because if you put enough product in the shaft, sometimes you'll have a bigger shaft in the head ratio, and it's a little, not proportionate. So sometimes I'll add more product to the glands and make that proportionate. And with those instances, it doesn't decrease the sensation. So it's kind of interesting. For only the guys that have premature, it decreases the sensation. But with the growth enhancement and the regular cosmetic, it really doesn't. So.
Interesting. Yeah. And by the way, guys, real quick, I just want to take a moment to say if you have questions on any of this, I'm going to cover a lot today, but I would love to hear your questions and bring them to the table. There should be, depending on what platform you're watching on, Use the little question bubble if possible. If there's a question bubble, it has a little question mark in it. I know on Instagram for sure it does. Please use that instead of the comment section because it's hard to go through all the comments and sort through and find the question you're trying to send. So send it through the little question bubble. We'll get to those in a little bit. Okay, so we have these different options for enlargement, sensitization, desensitization options, and the number one thing we're going to think about, I would assume, if I'm a guy, or generally if I'm even with a guy who is thinking about doing this, I'm going to think about how's this going to change him negatively? Like, that's the number one concern. So maybe we can start going through the risks of where this could, what this procedure.
Okay, sure, definitely. Well, with the more surgical options, you're going to have a little bit higher risk. Of course, it's invasive. They're making incisions and cutting, and these are permanent. So always say permanent processes have permanent issues. So if you had a permanent procedure and there was a problem, you're stuck with it for a very long time.
Yeah.
Right. And so so any medical procedure is always risks, but they're usually minor. We try to minimize the risk as possible. It is medical grade. I'm very, very particular about cleanliness as well. So everything is done sterilely, as if you were getting in a surgery. Even my non-invasive stuff, I betadine everything. I thoroughly disinfect. We're very sterile. I wear sterile gloves. So it is a very sterile procedure. And that's always a concern. It's like we want to minimize infection.
Absolutely.
Yeah, and then also in terms of the risk, there's really no risk for impotence, or that's what a lot of guys ask me. Like, if I get girth enhancement, am I going to be impotent? Am I going to have erectile dysfunction?
Yeah.
And the answer is no. Okay, but if you did have some of those issues already going into it, we can add PRP.
There's ways
to help with the erection as well.
Yeah, I love that. And so, as you're unfolding this kind of benefits and risks scenarios for us, I'm thinking about people may come to you who just have a issue that's like, oh, I have this weird divot, or I have this size of just the head that I need to balance out with the shaft, or I don't know other things that they might want to correct. But what other things have you seen come your way that are like, oh yeah, we can do that. We can do
So everyone's different.
Yeah.
So everyone's born with a different size and shape. Sometimes you have what's called a mushroom, or like a gnocchi mushroom, like where the glans is much bigger and the shaft is skinny. And sometimes it's the other way around, where the shaft is bigger and then the glans is skinny. So we definitely try to add proportion whenever they have disproportion. And then some people even have some curvature. That's fairly common. A lot of guys have curvature. Sometimes the curvature is more severe, and that's called Peyronie's disease, which is actually some scar tissue in there. You can actually treat that with PRP.
Huh.
But you can also treat curvature cosmetically by adding filler in certain places to give the illusion that it's straighter as well. So
very interesting. And the PRP stimulant, how does that work?
So the PRP is actually, it's growth factor, so it helps with scar tissue.
Okay.
So usually when people have Peyronie's disease, it's due to some sort of scarring. So by injecting the PRP, you're remodeling the scarring and you're helping to heal the scar in a better way.
So is the scarring come from like a circumcision scarring usually when that
internal?
Happens? Okay,
internal. Some sort of scar, some sort of accident. Maybe they were masturbating too hard or whatever. I mean, it could be a number of things.
Yeah.
They had some sort of trauma, blunt trauma, and it caused some scar tissue, and then it left them with a little curvature.
I think that's such a good thing to hear for guys dealing with that issue, because I mean, I don't know how long this option has been around, but it is very new to me. I mean, tell me how long it is.
The PRP?
Yeah.
PRP's been around for decades. Not in the penis, but that's probably been around for a little bit over 10 years, but PRP itself has been around for decades, and they use it a lot in dentistry and wound healing. But they know one of the factors in PRP is it helps with blood flow. So anything with blood flow is going to help the erection and help with the penis.
Yeah, that makes sense. Wow. Okay. So, other off the wall, anything that guys come to you and go like, "Hey, is this going to be an issue? Does anything come to mind for you?"
Yeah. So generally, they've done their research. They've already kind of decided. Usually, I screen them when they see me. They really are interested. They know they're just getting girth.
Yeah.
But I do tell them this. So even though we're giving girth enhancement, their flaccid length actually increases. Okay. I don't promise them.
Yeah, fascinating.
So I don't promise them that their erectile length increases, but their flaccid length increases. So many guys, we talked about this.
Grower, not a shower.
Grower, not a shower. So there's different types. There's some people that are growers, meaning when they're flaccid, they're much, much smaller. And then when they have an erection, it's significantly longer. And there's guys that are called showers.
Right.
They are the ones that like are well hung in the locker room, and when they have an erection, it's not that much longer.
Right.
It's still the same size. So I would say the growers are the most common, and then when I do the girth enhancements, they become more of a shower.
So how, like, tell us how that works out.
Well, when you're flaccid, the penis is actually retracted,
Uh-huh.
and so when I actually do the procedure, I pull it out of its socket. It's kind of like getting a turtle and you're pulling the head out of its shell,
Uh-huh.
and you make sure you fill the part that's retracted. Otherwise, I only filled the part that was showing. Later, when they have an erection, they'll have a missing part at the base.
I see.
So
Yes.
I yank that sucker out, not that part, but I retract it,
It sounds aggressive.
and then I make sure I fill it all the way down to the base,
Yeah.
all the way down to the areas that it doesn't come out normally when they're flaccid.
Yeah, that makes sense. And so also just the gravity of it, because there's more weight now.
Correct, that too.
Yeah,
That too.
that makes sense.
Absolutely.
Yeah, I never even thought about that, like the base of the shaft, that's where it retracted. So, and just to be clear, during the procedure, it's not as if you're saying you're pulling something out. It's not like you're doing something out of the ordinary that you would normally do, someone would normally
Right.
do, with just what you can do on yourself right now. It's not like
Right,
that.
they have devices that you can buy. They're traction devices. Have you heard of those?
Yeah, so this
Yeah.
is just with gravity.
Yeah, with gravity. So I've seen, I've not used it, but I've seen patients, they show me that there's different types on the market, but basically they latch on some sort of attachment onto the glands, and then there's a weight, and it kind of just hangs down.
Okay.
And they wear it, for like 20-30 minutes, and it's kind of like, it's like a stretching exercise.
So they're
like doing
basically
yoga.
lengthening that muscle that normally
Right.
would retract and make them a grower, not a show.
Correct.
Got it.
Yeah.
Yeah, okay, so that makes so much sense. Thank you for describing that,
Yeah.
because I needed to know more of a visual on that. I wanted to ask how much filler needs to get put into the shaft or glands. I mean,
Okay.
obviously it's dependent on the person.
So
obviously.
everyone's different. I would
Just
say
average.
probably most of my clients have the mentality of go big or go home.
Right.
I mean, no one comes in and just like, I just want a really subtle enhancement. I mean, they may start that way,
Yeah.
but as you know, when women get like breast augmentation,
It
the
just
fat
seems-
transfer to
yeah.
their butt, the more the better.
Yeah.
Sometimes women will get like a second fat transfer to the butt, or a third one, or get bigger implants because they like the first implant,
Yeah.
they just want to go larger. Well, it's the same with the guys.
Okay.
To give you an idea of some volume enhancement, like what that means, like 1 ml is like 1 cc, and typically like a teaspoon is 5 mLs.
Okay.
So it may sound like a lot, but if you imagine a teaspoon with a liquid,
All
and
the
that
way
being spread
around.
all over circumference, that's not a lot, right?
Yeah.
I typically do about 10 to 20 mLs at a time of a
Okay.
filler. And then I bring them in for a second or a third round and continue to add more as they need.
Okay.
And so if you want porn star size status, typically what I see is usually like 50 plus cc's. But that's not done in one sitting. That's usually done over time.
Yeah, and it
So-
of course depends on where you start from.
Right. But I also do fat transfer.
Yes, and
So-
tell us about this.
Yeah. So women get fat transfer all the time. You can do fat transfer to your face. Women get fat transfer to the buttocks to give that Kim Kardashian buttocks look. And now guys, basically, if they have fat, assuming they have fat, so I usually have them pinch their belly, and if they have a little bit of fat in their belly, I can liposuction or take that fat out
Uh-huh.
and put it in the penis, and that's a one-time deal. So,
And so what are the benefits of using fat over filler then?
so
And
the-
is that invasive then, considered?
it's a little bit invasive. I mean, still, you're awake. I mean, I completely numb the area.
Okay.
So the patients, they're awake, but they're not feeling anything. So
Okay.
it's like going to the dentist and you get your teeth numb.
So yeah, we're gonna come back to this
Mhm.
fat transfers is definitely another interesting option. But what is the nerve block? Like how does that all go down? So I'm sure guys are like, no one
Right.
is sticking any
Right.
needle near.
I know. It sounds really intimidating, but actually, the whole procedure itself is very comfortable. I mean, they don't feel pain at all.
Yeah.
So it's like there's a nerve. It's called a dorsal nerve penile block. There's
Okay.
one specific nerve that innervates the entire penis, and once you hit that nerve with a little lidocaine, the whole penis is completely numb. I
Okay.
mean, you can like sever it. I mean, they wouldn't
You
feel
know,
anything.
yeah.
No, and you can do anything you want, put needles, and they don't
Yeah.
feel anything.
Nothing. Okay.
Right.
Great.
Yeah.
Yeah, I can say I've never had the actual block like you're talking about, but even just the numbing that you've used for my face
Oh,
stuff that I've done here, I feel literally nothing.
Right.
The girls are sometimes like, it's kind of scary that you don't feel this at all.
Yeah,
But I'm like,
But you never
no,
got a
it's
dentist
wonderful.
for the dental block?
Oh yeah,
Oh, yeah.
absolutely, yeah.
So it's very similar. I mean, when
Okay.
they do the dental block and they pull the teeth, you don't feel it, right? So it's the same thing.
Yeah, cool.
Mhm.
That's good to.
It's very
That's
reassuring,
relieving,
right?
yeah.
Yes,
That's really,
yes.
okay, tell us about the fat transfer though.
So yeah, for the fat transfer, the benefits of that is that I can put as much fat as I want.
So, and I was even just thinking, maybe I have a very visual brain, maybe I'm very like men in this way, but I was thinking even by taking some of this fat away, your penis looks larger just because you now no longer have a fat pad.
Well, okay, so that's a good point. So a lot of times people, without surgery, can
Yeah.
improve their penis size by losing weight.
Yeah.
Because some of the fat pad on the mons pubis, right above the penile
Right.
penis, that area can can block it, make the penis look smaller.
Mhm.
So just by losing weight, that can give you a larger penis itself. But I typically liposuction them from their belly. They're stubborn
Okay.
fat.
Yeah.
And the reason I do is because that's stubborn fat. You know how like when you try to lose weight,
Can't
that's
get rid
the
of that.
last
Yeah.
place to go.
Mhm.
Your face is the first to go, but that's the last place to go. And so therefore, when the fat is going away, that's the last area to go away. So it's stubborn fat, but it's going to stick around longer.
And so you take that fat out and you essentially, in the same session,
Same session.
inject it into
Inject it back. Yeah.
Can it go into the glands and to the shaft?
So that one goes only to the shaft. So
Okay.
the glands is actually a spongy organ. So if you inject anything in there like fat and stuff, it can occlude the vasculature.
Oh.
So we typically just do it in the shaft.
Okay.
And there is a little bit of attrition. So with any fat transfer, including the breast or buttocks, so if you put in 100% of fat, there's some attrition. So usually like 50% will go down. So not all of it survives. So you have to do what's called overcorrection. So I usually will put a lot more product normally than what they would normally experience, knowing that it's going to go down after it heals and resolves.
Yeah, that makes sense. And you said how much does usually stays?
With a fat transfer, I put up to 70, 80 cc's of fat.
Wow.
Because
okay.
they want a good size. So I want them to have the appearance of like a 40 cc or 50 cc.
Yeah.
So I usually will go above and beyond like 70, 80 cc's.
And what is the healing time when you're doing a fat transfer, for instance?
So that one I typically tell people not to have intercourse for 2 weeks. Although I gotta say my patients tend to be excited.
Yeah.
They can't. Most of them can't wait the 2 weeks, and they always give me feedback. Hey, sorry, man, I had to go. I had to use it. I was so excited, and my wife was excited. So we were, after a week. But typically, the first week you're usually kind of sore.
Yeah.
So you can't anyway.
That would not be fun.
You're healing, so you don't want to really be messing with it or masturbating or anything. Just leave it alone, let it heal.
Yeah.
But yeah.
Also, just any kind of risk of infection, we don't
That
want
too.
to risk
That too.
for sure.
Right.
So
Right.
they're
You want all
sensitive.
the little holes and stuff to be told before you.
And again, it's just pinprick. I mean, it's literally like needlepoint holes, so it's not massive wounds that you're worried
No,
about
there's
closing,
no
but-
scarring. Absolutely.
Which
Well,
is
except for
amazing
the
that 2
lipo.
weeks is all it takes to
2 weeks.
heal.
2 weeks. Yeah.
That's kind of wild to me.
We'll show the procedure. We'll
yeah.
kind of demonstrate, not on a live person, but on a chicken neck.
Yes, we will.
Yeah.
We're going to do a demonstration in a few minutes here. The chicken neck is waiting for us. That should be fun. And again, guys, if you have any questions, put them into the bubble if there is an option. Instead of the comment section, put them in the little question mark bubble so that we can find them easily. And I know on some of these platforms you don't have that option, so you can drop them in the comments and we'll scroll through. Okay, so you're saying that, like, give me the kind of walk us through from start to finish. Someone calls y'all on the phone, or what is the procedure to actually
Great
get this
question.
done?
No, that's really important. It's not just about, hey, I want to book a procedure. I really take a deep dive and spend a lot of time talking to them. I've been going to why. Like I asked them like straight up, like, why are you doing this? And what's the reason? And I'm just curious to know if this is a legitimate reason. It's not for me to judge, but it still gives me some sort of insight into the reasons for it. For example, some guys will try to hide this from their spouses or partners. And I tell them, please don't. Like this is your partner, sexual partner. This is a very intimate procedure. You're gonna just surprise them one day, just like surprise. And I got a procedure now. Like, please discuss this with your partner before undergoing this, because if you're in a long-term serious relationship, that needs to be. You guys are partners. Right. Also had some sad stories as well. I had some stories where, you talking about the low blow.
Yeah.
I had a story of a gentleman who his wife left him and gave him a low blow, and for another guy, and she told him that the reason was because he was too small. Not that should ever happen, or but that was just part of it. It is ridiculous thing to say, and so he was all self-conscious about it. But so it gives me insight into how I can make them feel better and kind of counsel them before they undergo like a major procedure like this.
Yeah, and that's one thing I do love about your office is that y'all are really like sensitive and empathetic to whatever we bring to you,
Yeah.
as patients, whatever we bring in the room. Or one of your ladies, Kathy, I love so much, and she's like a Reiki healer too on the side, and she has this really compassionate way about her, and I just have had really good experiences feeling held and safe in this environment. So thank you for that, and that's why I'm happy to offer it to my following as well. I wanted to ask about building products. So like I know whenever you inject stuff in my face, it kind of can build over time because I'm like building up essentially like layers of it to whatever this bone structure I want to create or the fat look that I had in my youth I'm trying to replace. So when it comes to male enhancement, is there a build factor as you go?
There's a build factor. It's a little contrary to what most men want. Most men, at least in the aesthetics industry, their typical patterns that they don't want to, like women are okay coming every month or 2 months. They come in every 3 months for the Botox. You know, you get your lashes done every like 6 to 8 weeks, and you get your Botox every 3 months.
Yeah.
So men aren't so much into coming in so frequently. So they only want to come in as little as possible.
Yeah, it's a sensitive topic.
It is.
Yeah.
But with the growth enhancement, you can't. It's not a one and done unless you're doing a fat transfer, right? So if you're building it with filler, then it does take some time. It does take several sessions, which is again, and I think most guys are okay with that because first of all, going back to the advantages and disadvantages. The fat transfer is a one-time fee. We charge, for example, $6,500 for the fat transfer, and I can put as much fat as I want. Because
it's like you're going in if you got the fat to
your
spare.
Own fat.
Yeah.
I'm not paying extra if I get extra fat out. It's your own body.
Right.
So, and I like that too sometimes because it's natural. Some people are like they're a little worried about putting some sort of synthetic product which I understand. So if they have a little bit of fat, why not use it and put it back into your body and it's safe.
And now, going back to that as well, is there like I'm thinking about if you get liposuction, what is the recovery time on that?
Oh yeah, so like you did 1,000 crunches.
Okay, that's okay.
So you're gonna definitely be sore for like a couple of weeks with that one and bruised. So,
okay.
Yeah, but I do it just to get the fat out. So it's fat harvesting or fat grafting. I'm not lipoing them to trace out their six pack.
Right.
I'm just taking the fat out. So I'm just doing a simple fat grafting procedure to put it back. And then so that's fat grafting. But with the fillers, you know, it's the advantages versus disadvantages of fillers. One, it's easy. It's right off the shelf.
Sure.
I open the box, the filler's there, I put on the syringe, and I'm ready to go. It's super simple. I don't have to go and collect the fat and do that other procedure. So it's a little bit less invasive. But the disadvantage of the filler, not that's a disadvantage, but it can be a little bit more costly because you're paying per product.
Okay, so what's the cost on
So fillers are pricing. So it depends on who you go to and it depends on the product. I like to use what's called a high G prime filler. I like to use a product that's stiff and firm for obvious reasons.
Sure.
Right? There's different fillers on the market. Like, you know, women get their lips done.
This is super soft.
Super soft. You want to kiss someone's lip and not be hard. But for the shaft, you want something that's firm. That's that's going to mimic when they have an erection. That's not mushy or anything like that. So I use a product that is more filled. So that one, you know, we charge $8.90 per syringe, and so if you do more than 10 syringes, you definitely get a little break with that.
Yeah. Okay.
Okay.
And so, do you have an average cost on? So you're looking at $8,000 for 10 syringes.
$7,000-8,000 for 10 syringes, and these products can last 2 years.
2 years.
Yeah. And sometimes a little bit longer, but you know, for some reason down there, it lasts longer than in the face. That's my
because it's just like not getting the particular.
I don't know. Like these products typically in the face will last like a year or so, but when I do it down there, it typically lasts a little bit longer.
Very interesting. And does it matter if they're masturbating more or less or having sex more or less for it to last?
That's a good point. I would say in theory that if they're doing a lot of like sauna, hot yoga, high temperature environments, if they're in a lot, it increases your metabolism of the product.
Oh.
So, you know, if you're into the saunas and jacuzzis and things like that.
Yeah.
You're doing it
Everyone's ice bathing and saunaing and doing all the things now. Aftercare for this, because I know you can, just like with filler in the face, you can end up with some little lumps and stuff, but I would assume it's in the shaft, especially since it's more mobile.
Right. So, so I get this analogy, you know, similar to like when they build roads, they pour down the concrete, they pour down the tar, and
Okay.
there's usually a bulldozer that's round and kind of like just smooth it
Yes.
out afterwards. So I'm laying down the product, I'm laying down the concrete, the substance for the road. But then at home, they do need to massage it once it's healed or once it's healing, to
Mhm.
massage it to smooth everything out, because the product is mobile.
Okay.
That whole plane underneath the skin of the shaft,
Yeah, we'll
it's
see
one
that on
it's
the-
one plane, it's one like, continuous plane. So you can kind of move things around
Uh-huh.
in the very beginning.
Yeah.
After 2 months, it kind of gets incorporated into your skin. It becomes part of your body, part of your tissue. So after 2 months, it's hard to move around. But in the beginning, I do advise them to massage
Yeah.
and massage during an erection, because that's where that's where it's gonna set.
Yeah, that makes sense. Just thinking about like how I've been able to kind of right after a filler gets injected or something, kind of
Do a
mush it
little
around if I
massage.
have to. and
Sure.
it sets pretty quickly, it seems, but yeah, that would make total sense that you could
Play around with it.
just
Yes.
adjust it as needed. And then you mentioned something about a penis pump needed for aftercare.
So that was for the PRP.
Okay.
So the PRP, remember, it's the platelet-rich plasma. Well, you probably know it as a vampire facial,
Yeah,
vampire
uh-huh.
facelift. So Kim Kardashian made that really big by taking her blood and they spun it, and then they put it in her face and they microneeded it in her face. So the aftercare for the PRP injection. So I after inject the PRP is there to basically heal and stimulate wound healing and also angiogenesis, which is creating more blood flow. But it needs a signal. So
Okay.
the needle prick is an injury, so it signals that your body is injured. And then the penis pump is also creating an injury, so that the growth factors from the PRP can then go and heal and then stimulate more collagen, stimulate more blood flow. So that's why the penis pump is needed, because you want to basically, like when you work out,
Yeah.
you break down the muscle and your muscle rebuilds. It's the same concept. You're working out your penis. The PRP is there as growth factors to heal.
Fascinating.
Mm-hmm.
Yeah. Huh. That makes sense. Okay. Is there any pre-care? Is there anything like beforehand?
So with any injectables, even with your face and fillers and Botox, we tell people not to take any blood thinners for 5 days, like aspirin, Motrin, Aleve, fish oil. Any blood thinners are just generally not recommended prior to a major procedure like this to prevent bruising. It doesn't affect the procedure, but
Just the bruise.
just the bruising
Yeah.
to minimize that. as much as
I was
possible.
on fish oil once and I was having an injection done and it totally left a bruise.
Yes.
Did
And
not-
is it vascular? Like, have you ever had your lips done?
Yeah.
Okay, you remember the bruising?
Yes,
Yeah.
that was when.
Yeah.
The fish
Okay. Well, even if you didn't take fish oil, the lip fillers do bruise, and it's very similar. The lips and the glands is
Similar.
the same.
Yeah, same skin.
Like it's pink, the glands is pink.
Yeah.
It's soft. It's very vascular, and so it's rich in blood flow and the rich in blood vessels. So yeah, it's gonna bruise.
Yeah, that makes sense. I wanted you to finish walking us through someone coming from phone call to
Yes.
to being in the chair hearing procedure.
Yes. So there's a lot of questions that I go through. First of all, we do just a basic medical history, right? That's always
Sure.
like, what medical problems do you have? Do you have any diabetes? Do you have any health issues that may affect, prevent you from getting a procedure? I address for male enhancement. I address any trauma if they've had scar tissue, because that could affect my procedure. If they have scar tissue, I want to know about it. What is the scar? Because if I'm in there with a cannula and there's a scar tissue, I want to be aware that it's there. I don't want any surprises when I'm underneath
Right.
the skin. Really important, circumcision.
Yeah.
Okay,
That's
so I don't like to work on uncircumcised penises. You can have what's some irregularities, but generally I recommend people get it circumcised prior to. I have done a few, but generally the best candidates are circumcised penises. Right.
So tell us what.
Yeah. Well, the scar that you can add the filler, and it can create a it's called a pig in a blanket look,
I
a cheese
think the
wire.
filler will move up.
It'll move around, and it can cause some issues in the foreskin if it's in the wrong plane. So generally speaking, I do recommend people get circumcision. Although that hasn't stopped me from doing the procedure. Some people don't want to get circumcised, and I'll still proceed.
Yeah.
Just knowing that it can cause if you try to retract the
Yeah.
skin, you can have some issues. So that's really important that I know their circumcision status, any scar tissue, and again I ask them about why. If they have any curvature, I like to address that. Any other irregularities. There's also people that come in aesthetics. They have body dysmorphic disorder.
Sure.
We get a lot of those in aesthetics, but in the male enhancement world, we call it phallocentrism.
Phallocentrism. Learning
that
new
means
words,
that
yeah.
that's a real thing. That's
Yeah.
someone whose whole life and whole world revolves around the fence.
Yeah.
And so someone like that is going to be totally obsessed, and any little minor imperfections could throw them off or trigger them
Yeah.
in any way.
You're not really feeling good
Yeah,
about working
yeah,
with
exactly,
that.
exactly,
Like
exactly. And so they usually either see me in person for a consult, or they get on the phone. And so I do that initial intake, and then I go over their goals. Like, do you want to go gradual? Are you okay going gradual? Do you want a point size status right off the bat? Then I'll consider a fat transfer. So I try to evaluate to see what their goals are.
And so with fat transfer, is circumcision required as well?
Yes.
Same.
Yeah.
So same issue.
Prefer them to get circumcised at least several months before, and then they can see me.
Interesting. Okay, and so they make a call, you guys determine they are a candidate, and whether they sit in the office with you or do that over the phone, and then now they're in the office for the procedure day of, and how does that look?
Okay, so basically you're gonna come into the office, the ladies will greet them and then sign the consent forms. You're gonna fill out some paperwork, fill out your medical history, sign consent forms. We bring you back to the room. I have a specific like banner outside. When I do like intimate procedures like this, we do intimate procedures for women too, but we have a special like banner that we put outside the door, so it's like do not disturb.
Yeah.
Because sometimes you don't want other people just
Yes.
randomly walking into the room. And so we block them. We have them change into a special gown, and then we put a numbing cream on the pubis, symphysis pubis area. So it's right at the base of the shaft. We put a numbing cream there, and let them sit for like 15 to 20 minutes. Because that numbing cream is the area that I actually put the needle to
So
block
it numbs
them.
the skin.
Right. So we do a double nerve block.
Yeah.
So I numb them with a numbing cream, and it makes them numb so that when I actually inject the needle in that
doesn't
spot,
even hurt.
that doesn't even hurt either. So we're really
When you
kind.
inject the numbing, it doesn't even hurt.
Right,
Yeah.
right. So that's why it's a double numbing
Yeah.
procedure. So you double numb them.
Got it. Yeah.
And then after that, then we do some measurements.
Mhm.
So we take photos, and we definitely respect privacy. This doesn't go online. We don't showcase that unless you sign a photo consent that you're allowing us to use. But we wouldn't either like push your name or anything like that if you did sign a photo consent. And so that's important because we need to document.
Yeah.
We need to document
The
your baseline.
progress. Yeah.
And then after that, then we do measurements. So I measure the girth at rest without an erection, because this procedure is done when they're flaccid.
Yeah. I would assume because they're numb. So.
They're numb. I don't know. Sometimes guys may get a little.
Something happens.
Something may happen during the procedure. You start getting
like
stiff.
relax.
Yeah, I have to get them to relax and do some breathing. But then I numb them, and then we do the sterilization process where I completely sterilize the field with betadine or iodine, and then I put sterile drapes everywhere. I wear my sterile gloves, and everything is done sterilely from that point on. And then once I finish the procedure, then we do photos of after, and then we also take the girth measurements afterwards as well to document the progress.
Yeah, and some guys apparently like to watch this going on, which is interesting.
Yeah,
Quite
yeah.
Interesting.
If I was a patient, I know I wouldn't want to watch, because when I get blood drawn, I can't even look at
I
anybody.
cannot look.
I have to look away. But some people are.
But I was telling you earlier, I was like, well, this is a situation where you're like, screw my screw the nervousness and fear of this. I gotta make sure this is done right. So I'm gonna be right there with you, doctor, telling you exactly, like, fill in a little more on this side.
No, and I listen.
Of course.
I have to, it is their procedure, so I definitely have to take into consideration what they're trying to achieve. Yeah,
and I was telling you also, it's interesting being someone who, willingly comes in and gets injections and things like that in my face. I have that 10 minutes, I call it like a 10-minute of fear, that if I can get past that, then I can chill down and I can be right there with you looking in the mirror, like, no, I think we need to add some here, do some de-wrinkling, whatever it is here. And I feel like, I don't know, maybe that's a vote of confidence for anyone listening, that they can get through the scary part. It usually takes a few minutes of breathing, and y'all's team is really good at kind of helping distract you until you get to that zone.
Yeah, I think they're nervous up until once they realize that they're completely numb.
Yeah.
And I test them.
Hurt,
so before I actually start the procedure, I will tap with the needle. They'll go tap. Do you feel anything? They're like, nope, I feel nothing. So then I start. Otherwise, they'd be in for a surprise. But
for sure.
Yeah.
Yeah. Oh my gosh, so much fun stuff. Okay, so let's see, is there anything else we haven't covered before we move into a demo?
I think what expectations are in terms of girth enhancement. So average girth size, the data is actually 3.6 to 4.5.
Okay.
So that's the range. People think it's a lot bigger, but it's actually significant. So 3.6 to 4.5. And so when guys expect how many inches do I gain? Well, it's not an inch thing. So it depends on where you're starting. So it's a percentage.
Okay.
So if you start out at 4.5, or say, let's start with an even number. Say you're 4 inches in girth, circumference, and you want to increase by 25%, which is very reasonable with a girth enhancement procedure. That is 25% of 4. That's 1 inch. So you're going from 4 to 5. Even though it doesn't sound like a huge number, that's a visually big difference. Mm-hmm. And so, say if someone went from 3 to 4, that's an inch. That's a 33% increase. Yeah. Even though it doesn't seem like a lot, it's visually, it's huge. It's a big difference. Yeah. So those are usually my expectations is 20 to 25% increase in circumference.
In one session.
In one session, and again, it varies on how much product you get.
And if you're using filler or fat.
Correct. And also, everyone's different. I'll give you an example. I used between 10 to 20 cc's of a filler, but I had one patient. He was probably about 9 to 10 inches long, flaccid, which is unusual. Yeah. That's not normal. So 20 cc's to fill the entire circumference did very little. Yeah. Yeah. I mean, he had to get a lot. But anyway, my point is, if you are flaccid, 3.6 inches, which is average, if you're flaccid and you get 20 cc's, that's going to be significant versus someone who's 9 to 10 inches.
Yeah. Yes. So what do you see most commonly in your office? Like, obviously this person had a really long penis, the shaft was really long, you had to use all this filler, but is that really common for guys to be wanting to have girth that matches their length, or is it more common that they are, and do you deal with like micro penises or in the range of really small?
Yeah, I don't deal with micro penises. Usually there's that's congenital, right? So, and I've seen those in my practice. Before I did this, I was an emergency room doctor for 20 years. So I've seen those, and those may require a little bit more aggressive procedures. Mm-hmm. Usually in childhood they give them like testosterone creams while they're growing during their development to try to increase the size, and then usually by the adulthood they can do some sort of more aggressive permanent like surgical.
More invasive.
Because a true micropenis, it's very, very small. Okay. It's almost like a little clitoris.
Yeah. Yeah. Essentially, right.
So yeah, but what was the question again?
So what do you see most commonly? What type of penis do you?
I mean, normal guys. I mean, I think guys have the perception that the average penis size is actually a lot bigger than it actually is.
Watching porn all day long.
So
not helpful.
Exactly. So erect average penis, and this is a recent study all across the world, is 5.1 inches, and most guys think it's 6. If you poll guys, they think it's 6, but it's actually 5.1. Huh. And then the flaccid is much smaller, 3.6. So
right, and so that usually it's the kind of average size guy coming in trying to get something that's
not really.
Above average.
It's funny that you mentioned that. Like, yes, average guys that are a little shorter do want the procedure, but I have quite a few guys that are like, I would definitely feel like they're way above average, but they still want it. Yeah, it's interesting. They don't. I mean, it's not like they're insecure. They just want bigger. Yeah, but the more is better.
That is so interesting in this world of massive butts, massive boobs. I guess it goes along with that. The whole idea of like we just want to go big and go home.
Yeah, I was surprised because I would think I'd be attracting more of the guys who like average or below average, but no, the guys with larger sizes, they wanted to.
Fascinating. Okay, well, I think we should move it over to demo time, and then we'll see if there's any questions that
okay, great. Do you have any questions right now before we go to demo?
I don't think so. I think we've covered so much that this will be a fun little venture.
I have my little tray here.
I know. I'm gonna sit back here to be in the scene, in the zone with you.
And yeah, so we can't go live with an actual patient. I'm sorry to inform you, but Instagram or these social media, they'll ban that. But what I can do is just kind of demonstrate with a chicken. The closest thing I could find was like a chicken. So it kind of resembles sort of like a phallus. And the whole idea here is just to show how I do the procedure. So I actually have in a syringe. This is not a real filler. I used ultrasound gel. So I was more creative. It looks like a filler, but it's actually ultrasound gel. So it's inert, and we're just gonna insert it. So basically, at this point, I've already numbed the patient. I've already sterilized them. I've already given them the penile nerve block. They're completely numb, and then I can actually start my work. And so basically, and I've already done my assessment, and so they don't feel anything at this point moving forward. And what I do is, this is not a needle. Let me show you what this is. This is actually what's called a blunt cannula. It looks like a needle, but it's not sharp at all. It's a round tip. It doesn't stick or stab or do anything. It's not sharp. But what it does is it allows me to glide underneath the skin in a smooth manner and just really evenly distribute product. And you want this product distributed very evenly and smoothly. And that's where the artistry comes in. You know, you can have really skilled providers, but just having the ability to see and, you know, detect evenness. And so the needle is there because, again, this is cannula. It's not going to penetrate or pierce the skin. So I actually need to make a hole or access the skin with a little needle. And so I've just made a little insertion point with that needle. And then I can guide my cannula underneath the skin. And so this is very similar because the procedure itself, people think I'm injecting the filler into the penis. The penis is a sponge. It's actually, you know, it's actually a sponge. So you're not going to inject product actually into the sponge of the body of the shaft, of the corpus cavernosa, the medical term. So you actually inject it underneath the skin, and I do it circumferentially. And as you can see, the cannula is just underneath the skin, and then I can just layer tiny amounts of product using this cannula. And again, the patient's super numb. They're not feeling anything. And for some reason, this ultrasound gel is not coming out, but you kind of get the point. If it came out, I could show you the instant.
Chicken in there.
You can see the instant filling effect, but the ultrasound gel is a little bit thick. Let me see if I can play around with it to see if it'll come out.
And I wanted to mention too that the reason that we're doing this demo, and I thought that it would be important too, is because if you go on Ageless MD on Dr. Sai's office site and Instagram and whatnot, you will see that they do not hold anything back when it comes to showing you all the nitty gritty parts and technical parts of the procedures, which I think is fantastic. It's a little bit sometimes disturbing or hard to watch, but the reality is we want to know what's being done to our bodies. We want to know we're going in with someone who's skilled to do it. And so I love that you're willing to give us a demonstration or make this attempt and show us how this actually works so we know what we're in for if we're going to sign up for some male enhancement here.
Yeah, so the ultrasound gel is not coming out, but I think it is to imagine the results are immediate. I mean, whether it be the fat or the filler that I'm using, you know, this product eventually ends up underneath the skin. And then, you know, I'm just layering it all around circumferentially, all the way around the shaft to give that immediate pop, and the growth enhancement is immediately seen. Of course, there's some swelling involved immediately afterwards, and that swelling goes down, but this is basically the procedure for the shaft, and it's underneath that skin. So
and this, of course, is not the actual product that would be being used. This is just for the demo, but you would be using this denser filler.
The technique, yeah. I would be using a denser filler, and the filler would be in a syringe of whichever product that I choose with it. Typically I like to use Juvederm Voluma. Although the Juvederm family, they just came out with a new product called Volux. It's even stiffer. It's even harder than Voluma. You've heard of Voluma,
Yeah,
right?
I've used it.
So Voluma is a high G prime product. It's very stiff, and it goes into the cheeks.
I loved it. It lasted forever.
It lasted forever. So this Volux product is cool, and it's even stiffer. It's harder than Voluma, and they typically use it for like jawline and chin. You place it right to mimic bony structure.
Mm-hmm.
And again, bony is boner. It kind of goes along with you know, an erect penis, so the texture and the feel will be a lot stiffer. So it's interesting to see how that's going to be implemented in the male growth enhancement. But typically until then, I was using mostly Voluma.
Okay.
And there's also a product called Restylane Lift that I like to use. That again is stiffer, has a high G prime, it's very stiff. It's also used in the cheekbones and jawline. The only thing with the Restylane Lift, doesn't last as long as Voluma, but it still can give you that visibly visual result with a growth enhancement right away.
That makes me wonder also about because I know in the face you can dissolve products if for any reason you feel like,
Yes.
oh, there's too much here, or I don't want that much. Is that possible?
That's the great thing of hyaluronic acid is that one, your body already has hyaluronic acid. So for those that are thinking this is some foreign object, your body has HA or hyaluronic acid. So this is just processed in a way that your body doesn't break it down as fast, and therefore it gives you the 2 years, right? 1 or 2 year duration. There's other products on the market that that some people use as well. Some people might like to use what's called Radius. It's calcium hydroxyapatite. I was using that for some time, and it's very stiff as well. But the only problem with that is you can't dissolve it, so it's not
Radius
dissolvable.
is not dissolvable.
Not dissolvable. And then the duration wasn't that long. So I think, like I said, those guys don't like to come in every 3 months, every 4 months. They don't want to come in as the least frequency as possible. So 6 months option wasn't really something that I was like looking to give guys to have to come in every 5 or 6 months.
Yeah, that's a good one.
There are some products that some people are using it's called PMMA. That's a semi-permanent product. There's some clinics down in Tijuana that are doing a lot of that. Again, I don't have a lot of experience. I don't like to use that, and just being. It sounds attractive because it's like, wow, it lasts years and 5 years and plus. But truly, if you have any issues with it, it can be a nightmare to deal with. Because I've actually had some people that have had PMMA and they have me try to dissolve it. It's non-dissolvable.
Wow.
And so the only way to take care of it is to actually surgically go in there
And cut it out.
cut it out and remove it, which is a nightmare.
That does not sound fun.
So I stay away from those type of products. I like products that are safe, that I can dissolve, that give long lasting, that gives the same consistency as an erection. So yeah.
Cool.
Yeah.
Man, you've answered so many questions for us. I can't imagine someone has any questions that we haven't covered already.
You guys have covered every question that's come through. I guess maybe one that is still remains is what's the best way to get in contact if someone's interested?
So ageless-md.com. Phone number is 714-760-9918. And also on our Instagram is ageless_MD as a medical doctor is our Instagram. We post a lot on Instagram, but not a lot of. I need to post more male enhancement on Instagram, but it's a really hard thing to promote.
Yeah, I get it.
The Fallow Boards is really the only place that guys can come together and honestly talk about this stuff, because you don't have women telling their men, "Hey, honey, you may be into this procedure," and guys don't go to their buddies at the gym and get, "Hey, bro, guess what I got?" And people don't leave Yelp reviews of like, "Hey, I just got 10 syringes in my shaft." It just doesn't happen. So it's really tricky to get this information out there. You have to do it delicately.
And that's why I'm so glad we got to share this today, because these guys come to me in the DMs anonymously a lot of the time, because they are having struggles in this arena, or they're having confidence issues in this arena, and they don't know that there's places to turn for this. So I'm just glad to be sharing your work with them. So thank you
for let us use your platform.
Yeah.
And it's non-surgical.
I know it's really not a huge risk.
Right.
I mean, there is always risk, as we spoke about
Right.
today, but that's why I felt really here for it. I felt really excited about sharing it, because I have had all the options to improve myself and enhance myself in the ways that I felt I needed to at the time, right? Like I was talking about earlier, with breast aug or with fillers in the face and that type of thing for me. And having a part of my body that I felt really insecure about and not having any options, I was like, that just sounds shitty. I mean, here's the thing I'm going to say to kind of like have a sign off of here to anyone watching, that I can speak from my own personal journey of body confidence and that type of thing, that addressing the physical, and especially like in the ways we talked about today, where there are more benefits than risks, addressing the physical can be a really good way for finally setting that piece of the confidence journey aside and being like, okay, like I have this thing that I thought would give me all the answers. And oftentimes you'll find that there are some beautiful, amazing things about having a really aesthetically pleasing body, for yourself and to be in the world with. But you'll also get to find that whatever is needed to be addressed internally outside of that gets to now be addressed, because you took care of the physical part, and now it's about like, okay, what else do I need to work on for myself? So thank you for being a part of this journey and helping people to get that step covered for themselves.
Glad to be here. Glad to share.
Yeah.
Yeah.
All right, guys. Thank you for all the questions. Thanks for tuning in.
Thanks a lot.
See you later.
Yep.